Blood pressure regulation becomes increasingly complex as we age due to a combination of physiological changes. The human body undergoes natural structural alterations, particularly in the cardiovascular system. Blood vessels lose their elasticity over time, becoming stiffer, which in turn increases resistance to blood flow. This phenomenon contributes significantly to the rise in systolic blood pressure, the top number in a blood pressure reading. Simultaneously, hormonal changes, such as the reduced production of renin, a hormone crucial for blood pressure regulation, can exacerbate this condition. The kidneys, which play a pivotal role in maintaining blood pressure, also lose their efficiency, leading to further complications. Complications of high blood pressure in older adults. Hypertension, or high blood pressure, poses significant health risks, particularly for individuals over 65. Elevated blood pressure is a leading cause of cardiovascular diseases, including heart attacks, strokes, and heart failure. Uncontrolled hypertension can also damage vital organs, such as the kidneys and eyes, and contribute to cognitive decline. For elderly individuals, the stakes are even higher as their bodies are less resilient to the adverse effects of prolonged hypertension. Risks of intensive blood pressure control. While lowering blood pressure is crucial, aggressive treatments aimed at achieving very low blood pressure targets can be problematic for older adults. Intensive blood pressure control may result in hypotension, abnormally low blood pressure, leading to symptoms such as dizziness, fainting, and an increased risk of falls. Falls are a significant concern for seniors as they can result in fractures, hospitalizations, and a decline in quality of life. Additionally, intensive treatment can strain the kidneys and lead to complications such as electrolyte imbalances. What is the ideal blood pressure for seniors? Traditional guidelines suggest that 120/80ths of a millimeter of mercury is the ideal blood pressure for adults. However, applying this target universally to elderly individuals is increasingly questioned. Aging naturally alters blood pressure dynamics, and what is considered normal or healthy for younger adults may not be appropriate for seniors. Recent research indicates that for many older adults, a systolic blood pressure between 140 and 150 millimeters of mercury may be safer and more practical. This range balances the benefits of lowering blood pressure with the risks of overtreatment. Evolution of blood pressure guidelines. In 2017, the American College of Cardiology, ACC, and the American Heart Association, AHA, updated their blood pressure guidelines, lowering the threshold for hypertension diagnosis to 130/80ths of a millimeter of mercury. While these changes were based on studies demonstrating the benefits of rigorous blood pressure control, they sparked debate, particularly regarding their applicability to older adults. For frail seniors or those with multiple chronic conditions, striving for a target below 130/80ths of a millimeter of mercury may necessitate strong medications with severe side effects, potentially outweighing the benefits. Landmark studies on blood pressure management. The SPRINT study. The Systolic Blood Pressure Intervention Trial, SPRINT, published in 2015, was a groundbreaking study that reshaped our understanding of blood pressure management. The study included over 9,000 participants aged 50 and older, divided into two groups, one with a standard treatment goal of keeping systolic blood pressure below 140 millimeters of mercury, and another with a more aggressive target of below 120 millimeters of mercury. Results showed that the intensive treatment group experienced a significant reduction in cardiovascular events, such as heart attacks and strokes, and a lower overall mortality rate. However, these benefits came at a cost. Participants in the intensive group faced higher rates of adverse effects, including hypotension, kidney problems, and fainting. These findings underscore the importance of individualized treatment, particularly for older adults who may be more vulnerable to side effects. The chart study. Another significant study, the Comprehensive Hypertension and Aging Research Trial, CHART, conducted in 2021, further explored blood pressure management in seniors. This study involved over 20,000 participants aged 65 and older. While it confirmed the cardiovascular benefits of intensive blood pressure control, it also highlighted the increased risk of side effects in frail individuals. The CHART study emphasized that healthy seniors without multiple comorbidities could benefit from stricter targets, while those with complex health issues might fare better with more conservative goals. Personalized blood pressure goals. One of the key takeaways from these studies is the need for personalized blood pressure management. Factors such as overall health, medical history, lifestyle, and the presence of other conditions like diabetes or kidney disease should guide treatment decisions. For many seniors, a systolic blood pressure between 140 and 150 millimeters of mercury may strike the right balance, ensuring safety and quality of life without compromising cardiovascular health. Lifestyle changes for blood pressure control. In addition to medication, lifestyle modifications play a crucial role in managing blood pressure. Regular physical activity, such as walking or swimming, can improve cardiovascular health and reduce blood pressure. A balanced diet low in sodium and rich in fruits, vegetables, and whole grains, commonly known as the DASH diet, has been shown to be highly effective. Stress management techniques, such as mindfulness and meditation, can also contribute to healthier blood pressure levels. Quality of life versus numerical targets. For older adults, the ultimate goal of blood pressure management should extend beyond achieving specific numerical targets. The focus should be on enhancing overall well-being and preserving independence. Overtreatment and its associated side effects can diminish quality of life, making it essential to prioritize a holistic approach that considers the patient's individual needs and preferences. The role of medical monitoring. Regular medical checkups and open communication with healthcare providers are essential for effective blood pressure management. Doctors can help assess risks, adjust treatment plans, and ensure that blood pressure control strategies align with the patient's health goals. Collaborative decision-making between patients and their doctors is vital for achieving the best outcomes. Conclusion: managing blood pressure in older adults is a delicate balance between reducing the risks associated with hypertension and avoiding the pitfalls of overtreatment. While studies like SPRINT and CHART have provided valuable insights, they also highlight the importance of personalized care. By combining appropriate medical treatment with lifestyle modifications and a focus on quality of life, seniors can achieve better health outcomes and enjoy a longer, healthier life.